Since the first coronavirus case was reported in Lagos on the 27th of February 2020, Nigerians on the whole have been on high alert, with relevant officials manning every point of entry into the country. Commendations have been pouring in from home and abroad over the proactive steps by government in curbing the spread of coronavirus, as well as the consistent awareness campaigns and regular briefings to the public. These perhaps are the main reasons Nigerians are not panicking over the current situation. Now, with the common saying that prevention is better than cure, some Nigerians are taking advantage of the situation, with reports revealing that in some states there is the alleged hike in the price of hand sanitizers and facial masks. Also, the issue of information sharing remains critical, but health experts are of the view that information management and the continued cooperation of the public with relevant agencies is important. The Ministry of Health, the Nigerian Center for Disease Control, NCDC, and other relevant agencies have kept up the momentum in this huge challenge and have been meeting with relevant stakeholders to contain this infectious disease. Now, with COVID-19 reported in over 20 countries, including some African countries, experts are of the view that precautionary measures should be the key thing. Guests on this edition of Nigeria Today will shortly be sharing with us some of the updates on coronavirus and the consequences on countries. Welcome to the program. I'm Dennis Adigunloye. All right, with us in the studio to discuss update of the coronavirus is Professor Abdulsalami Nasidi. He is the Provost of the University of Africa and former Director General at the Nigeria Center for Disease Control. You're very welcome to Nigeria Today, sir.
Good evening.
All right, and also joining us is Dr. Josephine Okechukwu, Director Public Health and Human Services Secretariat at the Federal Capital Territory Authority. Thanks for joining us also.
Thank you. Good evening.
All right, I'll come to you first, Dr. Josephine. With only one case reported since last week, what is the current situation in the country? We are hearing rumors that there's another case going on. Just give us the accurate information.
So far in Nigeria, we've only had one case that was confirmed for COVID-19. The other cases were suspected cases which have been negative.
Yeah.
The last ones we had in Abuja was yesterday. The result came out last night. Some Chinese nationals that came into the country.
Yeah.
So we ran the test on them, and the result came out in the night, and they were all negative. So as at now, we have only one confirmed case in Nigeria.
All right, what would you say this is attributed to? In this would be regarded as quite a success if you compare with other countries. Professor Abdulsalami, this would be considered quite a success given we've only had one case in the last few weeks compared to other countries. What would you say?
Well, I wouldn't call it a success per se. I can say for now we are lucky in terms of that no cases have been trooping into Nigeria except this one for now. You know, we shouldn't start celebrating because many countries started with one, and before you know where you are, you know, they are doubling and quadrupling. Take for instance, not long ago there were no cases at all in Africa, but as of today we have 12 cases already. There are cases, take for instance Algeria, that reported last week, just one case, now have 5 cases. Egypt that had one case, now has the second case, and already are exporting positive cases abroad. So which means there could have been some viruses locking in there, and Egyptian nationals that travel out also exported the virus. So Africa is also now. Then we have now Morocco is having one case. So we have 6 African countries now reporting. Not long ago, the entire Africa was free.
Sure.
So we have to be, you know, careful and be on the vigilance.
So remaining cautious is
Yes.
critical. All right, how important are emergency operational centers, and do we have them in the country, Dr. Josephine?
We have many of them. All the states have their emergency operations center, and they are on alert mode now, except for Lagos, as has compared a case. So all, like FCT has its own emergency operations center that is on alert mode and is functional. So all states have been on alert mode.
All right, I would expect there will also be emergency toll-free lines that can be called in any suspected
all states
case.
have that.
Okay, what would be the important hygiene practices that we've heard about? Washing of hands and maintaining safe distance from those who may be sneezing or coughing, but just highlight for us what other things that we need to do as Nigerians to protect ourselves.
When we look at the mode of transmission of COVID-19, it's basically through sneezing, coughing, and through any respiratory tract secretion that can come in contact with any other body, any other person around, or with objects. And it could be in the air, so anybody around can breathe in that organism and get infected. So the way to stop all this or prevent it is through hand washing, which we have been emphasizing with soap, or the use of hand sanitizers, any alcohol-based chemical that will immobilize or kill the organism properly. So the other things to do is to make sure that we have a clean environment. Environmental cleanliness is key. And we look at it now, the weather is not too palatable with dust everywhere. So we should make sure that our environment remain clean. And then we should learn to cook our food, because the COVID-19 virus was, or is assumed to be from animals. The specific animal now is yet to be known specifically. So in handling the wild animals, exceptional care should be taken, and that means we have to protect ourselves from getting infected. The consumption of these animals for food is not even advisable. So if we need to cook our food, we cook them very well, especially the meat, the fish, the poultry, and then handle these animals. Any dead animal should not be eaten. And if we are handling them, we should be able to protect ourselves by wearing gloves and then using face masks. The use of face masks is being advocated too for environments where we have this COVID-19 endemic, because a case, any country that diagnoses a case is an epidemic already. So for the epidemic-prone environment, we should wear face masks and keep ourselves and keep our environment clean. And if we are sick, anybody that has any respiratory syndrome, symptoms per se, should stay away from the public, or stay away from where you have clusters of people, so that they don't transmit whatever they have to other individuals. And handshake too. During the Ebola crisis,
should we be refraining from handshaking?
Of course, we should limit it, because like Prof said, we were thinking we're free before, now we have a case. It might be in our country, but it has not been diagnosed. So everybody should be careful, right? It's not only for COVID virus, for every other viral infection or epidemic-prone disease. So such things are necessary.
All right, Prof. Abdusalami, let's just go into a little bit more detail about the coronavirus, COVID-19, as is sometimes known. It's a new strain, I understand. How far have we gone in terms of research into this infectious disease and possible identification of cures and that kind of thing?
Well, as you rightly said, and as the name reads, they call it a novel coronavirus, which they now are calling SARS-CoV-2 or SARS-2 virus that causes COVID-19. COVID-19 is the disease. So it's actually a strain that is similar to the SARS virus and that we knew before, and then the MERS virus, which is the Middle East Respiratory Syndrome virus. But the key is that since it's a new virus, we don't know a lot yet about its property, but we know it is an RNA virus, just like these other viruses. It has a coat, and it multiplies only after it has infiltrated into the cells. So
it cannot live outside of cells?
No. It can live outside for some time, not for a long time. But since it's transmitted through droplets. So if it is, expelled out in a droplet, and the droplet lands on a surface, if the virus remains inside that droplet, it can last between 6 hours to about 9 days.
Okay.
Yeah. So this is why these stringent methods of protection that Dr. Okechukwu has mentioned is so important. We don't take this for granted. It's sensitive to temperature, and they realize that anything after 21 to 37 degrees, it doesn't.
It cannot survive.
Survive. But only if it is dry. But if it's in the liquid, this thing, it can survive a bit longer. Then secondly, luckily, because the science, especially biotechnology, is so advanced now, it took the Chinese very short period, to not only identify the virus that was causing that disease in Wuhan that time, but to even sequence the gene. So, and then sequence the gene and then distribute it to the world. So that, look, this is what is causing this disease, this is the information, and then, you can use it to develop vaccine or to develop drugs. So many laboratories in the world were happy to have that information. And now we have about 20 laboratories testing and, developing the vaccine. So the WHO DG said, according to WHO records, there are 20 candidate vaccines now being developed. So using that type of gene, if you know the property of the enemy, you know how to fight it. So they are also using to see which drugs will be effective. There are some of the drugs that they are finding in Russia, in Israel, in China itself. They are making some progress. So these are the information that we need. But what Dr. Okechukwu said again, even though we know much about the virus now, we don't have concrete information from which animal did it really concretely join. So these are the informations we have for now.
All right. In terms of the isolation centers, Dr. Josephine, where can we find them?
In FCT, we have in University of Abuja Teaching Hospital, the emergency or accident and emergency center. Is a new structure that is on ground now that has been activated. Like the patients we had yesterday, were accommodated there. So we have that in there, and we have in National Hospital. National Hospital, we have the isolation sites. 2 beds are available there. But for now, the teaching hospital staff have been trained fully to manage the cases, because the center is close to the international airport anyway. So it's more advisable to manage patients. All
right. Am I right in saying that given the enigmatic nature of this COVID-19, in comparison with Ebola, it is nowhere near as deadly? Am I right in saying that?
It's deadly. That's why the case fatality is very high. Right? Because when you look at it, it just came in December 2019. Within a space of 2 months, over 2,500 deaths have been recorded, and we are still counting. So it's very deadly.
All right, Prof, I don't know if you heard, I'm sure you probably did, the National Assembly wants to suspend plenary for 2 weeks, given the influx of people that go in and out of the complex without the type of stringent scrutiny we're seeing at the airports and seaports. Just give us your take on their request or desire to go on leave, so to say, for 2 weeks.
Well, so some might look at it as if it's a selfish move, but in the real sense, anywhere you have such threats, especially a virus that can fly quickly in a group of people and communities, we should start thinking of social distancing. And so what they want to do is right, technically, but maybe politically people are viewing it as if it's selfish. But the places like Lagos that have the real virus now present there should start thinking about social distancing measures.
That's very important.
So we shouldn't take chances at all. The National Assembly, took the right public health decision if they even disperse. Other groups should start copying them, but at the same time, they shouldn't forget their national responsibilities.
Sure.
That this is the time of war, and they shouldn't abandon this. There are many ways that they could continue their job, even if they are dispersed. There are digital ways, many technical ways.
Sure, there's certainly ways around continuing to do their job. All right, the program is Nigeria Today, and we're discussing the latest on the coronavirus. We'll take a break now and get a feel of what Nigerians are saying on the infectious disease. They spoke earlier with our correspondent, Butwa Miller.
It's just a zoonotic infections that just mutates to human infection now. It's just a viral infection. In a normal layman, it's a fluid-like infection. We still need to reactivate the emergency response we had during the Ebolas. That's personal hygiene in a strategic place and avoiding crowding places.
Coronavirus is the in thing now, all the world over. It's an infectious agent, and it's causing a lot of havoc globally in terms of its disease impact. Nigerians, we don't need to panic. Nigeria, as a country, is doing its best, especially when it came to infectious diseases. When Ebola came here, Nigeria stood up and fought it. And I believe likewise in this coronavirus issue, we will rise up to the challenge because we have the personnel to do it if we channel all our efforts to do it.
Coronavirus, to my own understanding, in a local way, in a layman way, we were just sitting and somebody said there is a disease that's in town now. Oh, coronavirus. I don't know much about that coronavirus. But we're advised to take care of ourselves. We should always cover our mouths while sneezing. We should also always wash our hands with soap. And I don't know much about coronavirus, honestly.
Currently, there is a form of coronavirus infection that is going all over the world that is getting to pandemic level. Pandemic means it's affected the whole world.
Well, coronavirus is an airborne disease that recently emanated from Asia, specifically China. And it's an infectious disease that no cure has been found, no vaccine has been found. It has to do with flu. And the only thing that we have to do is to maintain personal hygiene in order to curtail from it.
All right, welcome back to the studio. Our topic is the updates and latest on the coronavirus disease. Our guests are still with us. Professor Abdulsalami Nasidi, Provost of the University of Africa and former Director General of the NCDC, and Dr. Josephine Okechukwu, Director Public Health and Human Services Secretariat at the FCTA. Dr. Josephine, you heard some of the comments from members of the public there. How would you assess their level of awareness of this in this outbreak? How would you assess their understanding? Would you say that the awareness is there?
The awareness is there, but not fully, because when you look at it, it's like the enlightened section of the populace that are aware of this COVID-19 we are talking about. But the people in the villages, in the community, the hard-to-reach area are yet to be reached with the information on the COVID-19. So we should create more awareness in the communities. Good thing we have the social media where people get information from, but it's still limited. So we need to do more in terms of awareness creation.
All right, Prof, just give us your take on what you heard from some members of the public there.
Well, as you can see, there's apprehension. They are having some knowledge of the disease, and they knowing that the impact in other countries is, very severe. And but as you can see, they are not aware of the state of readiness of the nation. So they are not really confident that we can, handle this. And so we need to do more to reach the masses. And the people you interviewed are the enlightened people. But we have people in rural areas, we have people, you know, that we should reach, and if you don't reach them and this in, you know, consolidates in the community, it will be really be devastating. So the level of information dissemination that we need now must be very, very high. We need, this can be handled mostly by Ministry of Information, you know, National Orientation Agency. It's a very serious issue, you know, and then what people are doing, private media houses and so on and so forth. Everybody must contribute to make sure that every Nigerian knows what to do to protect he or herself, you know, from this deadly virus.
Sure. All right, Dr. Josephine, just to get an idea of just how serious this situation is, the outbreak has affected a lot of sectors: aviation, tourism, business, and even sporting events. And there's even a threat that the upcoming Tokyo Olympics in June, July, August, that period is going to be perhaps shifted, suspended. Just give us your thoughts on this.
My take on it, I think it's a good thing, because when you look at it, the transmission of this disease is like increasing every day. A lot of people are coming down with it, so we shouldn't take that for granted. And if it should be that more people will be infected, that activity should be postponed for now and let the system recover to some extent. Because when you look at it, and it's a world event that requires a lot of people to attend, and even the scare of entering aircraft now is a problem. So even in Nigeria, it's still an issue. If there's anywhere the whole world will gather together until the disease is controlled. We are talking about control now, so that the mortality will come down, the mobility too will come down. That will help a lot. Sure. And the country is doing a lot, the whole country is doing a lot. The international world, WHO, Center for Disease Control, every other stakeholder, they are on it to make sure that they control this infection. If that happens, that will be very good. We should do more, we should save more lives and suspend every activity that further jeopardize the health of the people for now.
All right, Professor, recently we heard about this issue of big manism. A lot of highly placed individuals feel that they should be exempted from all these rigorous processes of screening and whatever testing is required. Just give us your appeal to those who have that mindset that they are not involved in this global challenge.
So actually, that information, when it started coming down, means that we have not been able to convince our people that we are dealing with a highly pathogenic, highly dangerous disease that we shouldn't toy around with. If the so-called VIPs knew what we are talking about, and they see what is happening in other countries, they will never even try to say that they will subject themselves to this. And so nevertheless, there are many ways of testing people when they arrive. We have the gun scanner. So if the VIPs arrive, they don't follow that same line with us, and they take them to the VIP lounge, you see they have bypassed that route, so you might not blame them for that. So the Port Health should now have additional screening posts around where the VIPs are going out. So every VIP that is coming, we must use the scanner on him and get him to record you know, the information. Then secondly, the issue of you know, services at the Port Health level should take into consideration the fact that you know, the separation of, you know, the passengers, you know, that is made on who have Nigerian passport, who have foreign passport, and then who are the VIPs that they are really welcoming, like government officials, secretaries of the government, and so on and so forth. You know, the only thing that can put everybody on spot is to activate our public health policy. That and the laws. We have a law, and that law stipulates that you can't endanger the health of others.
Absolutely.
Because of your personal, you know, feeling or personal position.
Correct. We'll have to leave it there, but certainly your point has been well articulated and by God's grace well received. Professor Abdul Salami Nasidi, Provost of the University of Africa and former Director General of the Nigeria Center for Disease Control. Thanks very much for your inputs and expertise on this topic.
Thank you very much.
And thanks also to Dr. Josephine Okechukwu, Director Public Health and Health and Human Services Secretariat at the FCTA. Thanks also for your time with us and thoughts.
You're welcome. Thank you.
Thank you very much.
All right. And thanks also to our viewer. Remember, you can watch this episode and others on youtube.com/NTA News 24 Hub. I'm Dennis Adigunloye. Thanks for watching.